Hi everyone, my name is Sherry Stoka, and I am owner and founder of Weight Loss MD, which is a medical weight loss and wellness business. And today I'm going to talk about preparing for the maintenance phase. So obviously, I'm going to be really talking about the GLP medications and things that you can prepare for afterwards, but really you can take this information and use it for any type of program or protocol you're using to get into a healthier state. So I'm really excited to present this to you because I feel like it's going to really kind of bring things together and help you understand how you can maintain weight loss after the actual weight loss itself. So today I'm going to be talking about important factors when weaning off of the GLP-1 medications. You'll learn tips for transitioning to potentially another GLP-1. What's really important is learning to assess your own metabolic health, not only assessing it, but really realizing where you're at from a health, standpoint. We're going to discuss what keeps many people stuck in maintenance. You'll learn about different medications that may be contributing to weight loss resistance, and also like nutrient depletions and things along those lines. We will discuss environmental substances that absolutely contribute to weight loss resistance. So it's really important to take a step back and assess your health. And really, it is about metabolic health. Metabolic health really is the driver of all health conditions. So I will talk a lot about this. But again, it's really getting you more in tune to what is going on in your body and how you're feeling every single day. So, what is your medical health status? What type of symptoms are you experiencing day after day? Are you regularly getting labs done? Is somebody reviewing your labs with you? What is the status of your gut health? What is the status of your toxin exposure, which we will talk more about? How many different medications are you on? Are you taking supplements? What type of supplements are they? Are they helping you? Are they hurting you? And, all the things in between. And then obviously talking more about just some of the basics, sleep and stress, because that is, again, one of the most foundational aspects of our health. So medical status is really, what diagnoses do you have? Do you have autoimmune conditions? Do you have IBS, Crohn's? Are you dealing with lifestyle conditions such as reflux, cholesterol, blood pressure, sleep issues? Are you experiencing asthma? Do you have diabetes? That type of thing. So the first and foremost is really kind of, understanding that when you have a diagnosis, there's metabolic dysfunction. So we have to really kind of dig into that and see how we can turn that, really address certain things so that you're not always going to reverse, but you certainly can in many cases. Many people get lab values done and nobody has any idea what was tested, and there really doesn't seem to be a lot of education on the healthcare practitioner side and really, going through some of the labs. So taking ownership and going through labs and really understanding what certain highs and lows really could mean. We are big into assessing symptoms. Symptoms truly tell a story. And this is just giving you an overview and highlight. Again, you're going to be getting a ton of information in this presentation, and I really encourage you to watch it numerous times and just take pieces of it and try to apply it to maybe what could be going on in your life. So again, physical presentation, if you're having certain issues with your hair, your nails, your tongue, your skin, that could be signs of a vitamin deficiency, something maybe going on with your thyroid. Are you experiencing food sensitivities or some type of protein deficiency? Physical symptoms that are related to your eyes, your ears, your nose, and your throat. usually are some type of environmental exposure. That could be mold in your home. I can't tell you how many times we are seeing people and helping them really kind of detox and remove and repair and things that could be exposing them to these toxins. Are you experiencing neurological symptoms, anxiety, brain fog, dizziness, balance issues? That could be also an environmental toxicity. It could be a blood sugar dysregulation. It could be just inflammation in the body. Changes in your energy, your sleep, your weight, if you're sick very frequently, that could be tied to hormone imbalances, nutrient deficiencies, and again, environmental exposures. So you can see environmental exposures, which many people do not talk about, really does affect your overall health. And then you have your gut, your GI symptoms. Are you experiencing constipation, diarrhea, stomach pain, reflux, constant burping? That is definitely, these are signs of a gut dysbiosis, gut imbalance. So do you need to dig a little bit deeper to find out what is going on that's contributing to these symptoms? Because the gut is foundational to the human body. It plays a role in almost every system of our body, and it is connected to the brain. So whatever happens in the gut happens in the brain. Whatever happens in the brain, it's like a two-way street. It's in constant communication. So again, I'm just kind of scratching the surface of, really what could be going on symptomatically, but what you will listen and things will resonate with you, and you'll kind of take the information and move in a direction that really is applies to you. Body metrics is crucial, and it probably is one of the easiest things that you can assess when looking at weight loss. Is the weight loss a healthy weight loss, or is the weight loss actually hurting you? And if you don't know if you're losing either fat, muscle, lean body tissue, water, etc. If you don't know that you're losing that during weight loss, it's going to be really hard to assume that weight loss is healthy for you. So we really encourage people to find a way to track their body composition. And you can do that by getting home a body composition scale. You can also search certain more comprehensive or more sophisticated body composition assessment scales in your area. One of them being InBody, INBODY, and there's another one called the DEXA scan. So that's really going to give you a snapshot of your body composition, because that's the driver that's going to give you an indication of your metabolic health. What medications are you on? You need to reassess your lifestyle disease medication. So a lot of people are on medications because of their lifestyle decisions, because of their diet, because of their sedentary lifestyle, because of just unhealthy habits. They are requiring now medication to manipulate a number, essentially. So we are always assessing medications as people go through a program, because they are changing your health. So it's an opportunity for you to look at your medications, find out if you really need it. Can you start having the conversation with your doctor to wean off of it? Have you lost 20 to 30 pounds and now you need an adjustment in your dose? Are you on a medication that is contributing to weight loss resistance? I can't tell you the number of times we are getting people weaned off of certain medications and the weight just starts to fall off. And is there an alternative to a medication? And there always is. And obviously that is a very individualistic type of approach. But for example, sleep meds, there are so many different ways to help with sleep than taking, just these really harsh medications that really is kind of altering metabolism and that type of thing. These are just examples of some lifestyle medications. And again, lifestyle medications are used to address conditions based on your lifestyle, right? So if you fix the lifestyle stuff, then it's easy to get off of these medications. They are used to manage illness. They are not designed to treat the problem. So always keep that in mind as well. Over 80% of chronic conditions are lifestyle driven, they're reversible. And just some of the lifestyle examples, the medication examples would be if you're taking something for blood pressure, for cholesterol, for reflux, sleep, erectile dysfunction. I, I put sleep in there twice, and anxiety and depression. Of course, this doesn't apply to everyone, and I know there's going to be exceptions to the rule. But for the most part, the majority of people who are on these medications, it is because of behaviors and food and things along those lines. Lifestyle medications, they alter our body's normal physiology. So again, they are not designed to fix a problem. They are designed to manage symptoms. It's as simple as that. They are often full of fillers, additives, preservatives, dyes, etc. So if you are on certain medications, I would absolutely ask for an ingredient list, especially if you're still dealing with certain symptoms and things like that. Like I said, they're designed to suppress symptoms while the illness remains. You know, it's as sad as it is, that is our healthcare system. There are no known effects of combining multiple medications. So if you're on 3 or more, some people are on a lot more than that. There are no studies testing multiple meds being used at once. So again, you have to kind of start to question those things. Do you need all of these, and is it helping? And is there potential for interaction and things not working well together, essentially? Most medications that people are taking are not taking prescribed by the drug manufacturer or the manufacturer's recommendations. That is separate from the doctor. So for an example, if you're taking a reflux medication, on the package insert, it says that this is a very short-term medication and you should not take longer than 3 weeks. Some people are on it for over 5 years. So again, really taking ownership of everything that you're putting in your body, asking your doctor the right questions, because a lot of things that we're being prescribed, we are just doing because we're trusting in what they're telling us, but it really is about really listening to your body, doing your own research, and collaborating with your physician rather than just listening to everything they tell you to do. Many medications cause nutrient depletions. We see it over and over and over again. And again, approximately 80% of chronic diseases are preventable. These are the common meds that inhibit weight loss. And again, I'm not going to go into details of how this happens, but the common ones are antidepressants, synthetic hormones, antihistamines, beta blockers, sleep aids, steroids, diabetic medications, mood stabilizers, anti-epileptics, and antipsychotics. The big ones that we see often are going to be the synthetic hormones, the beta blockers, sleep aids, and steroids. Like I had mentioned earlier, there are 0 studies testing polypharmacy. People are on a multitude of medications and they have no idea if there's contraindications or interactions with these medications. We're going to talk a little bit about obesogens. And I really encourage you to start digging into this a little bit more, maybe doing your own research, because there's a lot of research showing how the different compounds that we are exposed to on a regular basis are making us fat. So obesogens are chemical compounds that affect normal development of and function of lipid metabolism and our endocrine system. So our fats and our hormones. They alter fat storage, they alter our set points, they disrupt energy balance in our body, meaning our body is not using fat for energy because there's an alteration of how the body perceives that. Obesogens modify appetite regulation. It puts a significant strain on the liver, which is so crucial for optimal metabolism. And essentially, it pollutes our body. And they are everywhere. Everywhere. There's lack of regulation. The number of chemicals that are allowed in all of these products. Our food, our water, baby toys, cookware, cleaning supplies, personal care products. They are everywhere and it does get overwhelming. That's why, again, it's an opportunity for you to assess your own lifestyle and start to develop kind of a plan as you listen to this and things that really, and things that resonate with you. Obesogens studies show that they do a number of things. So they increase the number of fat cells, so it's called hyperplasia. They increase the storage capacity of a fat cell called hypertrophy. So the fat cell is able to hold more calories. It shifts energy balance to more energy storage, taking you away from fat burn, more to energy storage. It alters your basal metabolic rate. It alters our gut ecosystem, our microbiome, to produce more fat storing bacteria. And obesogens modify our hormonal control of appetite and satiety. Food obesogens are everywhere. Our food is highly processed. Hopefully, we're starting to learn a little bit more about how terrible the standard American diet is and making better choices when it comes to that because it truly is foundational. All of this doesn't really matter if you're eating really crappy food and junk food and fast food every day. All of this really does not matter because you will be spinning your wheels. So the food is crucial. Making sure that you're getting good, clean meats that are not full of hormones and all the other things that may be put into the meat to preserve it for a longer period of time. And that includes antibiotics. High fructose corn syrup, we probably all have heard of this, probably one of the worst things had been identified to cause obesity. And relatively quickly. So high fructose corn syrup is derived from corn, but once processed, it turns into just a chemical. So people might think, oh, corn's healthy. This is not even related to the actual food. Food companies are allowed to use this and use many different names and that type of thing, which again, it can get a little convoluted and overwhelming, but when you start to really educate yourself on like real food, you will see that there's not many ingredients that you have to worry about when you really are choosing healthier options. Many food additives that are obesogens are designated by the FDA as generally recognized as safe. So what that means is the FDA has not tested any of these. They just are recognizing them as they're generally recognized as safe. It's just a way to protect them, but it's certainly not protecting us as consumers. If you're drinking tap water, find a different source of water. There are many heavy metals that leach from the pipes. Modern plumbing now is made up of PVC, which is a major obesogen. Fluoride, very, very toxic. Fluoride is a major obesogen, and we are getting it in so many different areas now. If you've listen to the news or if you do a little research, you're going to notice that they're starting to regulate fluoride being not only put in our water, but put in our toothpaste as well. Utah and Florida recently banned the addition of fluoride to public water systems. That's how much research is on this. And again, this is where a lot of a bit of the corruption is because we don't hear about this in the news. And it's really, it's really sad because I feel like a lot of things are going to start to come to the media. I feel like a lot of it has been kept quiet just to kind of maintain the status quo. But again, kind of just going back to as you hear certain things, do your own research and make your own judgment on how you want to proceed. So where are toxins stored in our body? A lot of people will say, oh, we have such good detox systems. We can just, anything that comes in, our body gets rid of it. And that is partially true. And if you even just think of back even, 30 years ago, 40 years ago, we were not exposed to as many toxins. Our ancestors really weren't exposed to anything. So when we are living in a clean environment, our body can handle it. But now we are living in toxic soup and our body can no longer handle it. So now a lot of these toxins that are coming in, we store it. And most of them are what we call lipophilic, meaning that they will accumulate and store themselves, find their way in the adipose tissue, so the fat cells. They tend to accumulate more in the visceral area, so the deeper belly fat. And once they start to accumulate in that fatty area, the deeper belly fat, that contributes to the insulin resistance of the visceral fat cells. It contributes to the inflammation. Visceral fat is very resistant to weight loss, and this is just part of that whole picture. If you've ever done the keto flu, you might have heard people talking about the keto or the keto, if you've done the keto diet, you may be familiar with the keto flu that people talk about. And that's simply all the toxins going into circulation because the body is mobilizing and breaking down the fats. And so because they were all stored there, they're kind of going into circulation. So that's why people will feel terrible because that's now, it's going through, it's being circulated through their body. It's really important to understand that toxins can recirculate and be reabsorbed if you don't excrete them. So that's why it's really important to have a healthy liver, healthy kidneys, healthy gallbladder, because your body has to be able to get rid of the foreign and toxic materials in your body. And if it can't get rid of it, it will build up and cause more inflammation and increase your risk for disease. So obviously you want to minimize stuff going in so your body can catch up. It's just like a plumbing system, right? If the plumbing is clogged, you're just going to keep adding to the problem and get sicker rather than cleaning things up. I know this is a busy slide. And again, I really encourage you to go back to it because this is where really a lot of the toxic ingredients, the toxic compounds are in not only in our food, but in our household. So signs of toxicity, signs that mean signs and symptoms meaning indicating that your bucket is too full. You can't handle much more because your body can't keep up with getting rid of it. If you are continuously gaining weight, you have weight loss resistance, constipation, you're constantly tired, you have skin problems or acne or breakouts and rashes, that is a sign, definitely a sign. Headaches and migraines, mood swings, bad breath, muscle pain, overheating, sweating, and insomnia. These are kind of the telltale signs that you're toxic loaded. Okay, so that was a lot of information, bringing it all together. So with all of that being said, you want to, again, start asking yourself these questions. What lifestyle diseases still persist? What direction are the symptoms pointing you in? And again, there are many symptom surveys, and I don't, whoever you're working with, you can ask for a symptom assessment, or you can do a little research on, yourself to identify what certain symptoms mean. Kind of go back to that one slide, that may help as well. Do you have labs available for review? What does your gut health look like? That is going to be really important. What lifestyle habits could be contributing to overexposure of toxins? That simply could be that you drink tap water every day. It could be that you're a hairstylist and you're exposed to those chemicals every day. So really identifying like the low-hanging fruit. Are you taking medications that are known to cause weight loss resistance? And are you not sleeping well, and are you overstressed? So all of these things could still be keeping you in that stuck state. So it's an opportunity for, again, you start identifying the things that you can work on. I'm just going to talk a little bit about transitioning to a different GLP because there are two main ones on the market right now. There's going to be one coming out very shortly, but the pipeline is vast. We're going to be seeing a lot more coming out. And what I can tell you is that we're constantly switching people from one GLP to another with success. So if you're at a point and you're thinking about stopping, you know, whatever you first want to ask, why do I want to stop the medication? Is it due to side effects? Is it because you're no longer losing weight? Is you're just plateauing, lack of response, that type of thing. So most people, I think, probably start with semaglutide, but then you can go to tirzepatide. You can, some people are offering retatrutide. We're offering retatrutide, so that's an option. You can go back and forth. Sometimes you try one, go try another one. You can always go back again. And we understand why you're able to do this from more of like the mechanism of action and the science behind it all, but because we are just trying to help you understand different options from like a bigger picture, these are things to just think about as you're working with your healthcare provider. Tirzepatide is Mounjaro and Zepbound. And those are, so studies show that tirzepatide and retatrutide studies have more weight loss with less side effects. We definitely see less side effects with tirzepatide. We see about the same weight loss with semaglutide and tirzepatide. And then retatrutide is the newest one. It's not yet FDA approved, so it's not being used as much. There are some compounding pharmacies that are offering. We actually have done a study. We use it on occasion, but the big ones are tirzepatide and semaglutide. So what we often talk to our patients about is strategic weight loss. And I'm just introducing this topic because it can be used in so many different ways. And whether you are weaning off of medication, whether you are stuck, because GLPs eventually stop, right? They can help you maintain, but eventually the weight loss will stop if you're not doing kind of all the other things. But we have been creating our own weight loss programs for over 10 years now, and we are very strategic in how we do that. So with some of our patients, we will occasionally start them on one of our strategic weight loss programs that are quick weight loss. They're 30-day programs and they do a number of things. They help with your detoxification. They really target the visceral inflammatory fat. You are following, it's very structured. You're following a very clean, structured diet. People will almost notice inflammation in their body go down. The cravings will go away. So we're getting the body into a healthier state in a very structured, quick way. And so again, it doesn't really matter where you are in your journey. You can utilize strategic weight loss at the beginning, during, at the end. And so it's something to think about if you've been working on your, health for a long time and you just really need something to move you along a little quicker. We can talk to you a little bit more about this. So another big piece to the picture of health and weight loss is supplements. And some can be hurting you, some can be helping you, some might just be inert and not really doing much. So, really working with somebody that knows what they're talking about. What supplements are you taking? What is the quality? Are they customizable for you? Do you need them? Consider supplements while you're on GLPs that actually help with the process. They help naturally boost natural GLPs in our body. We're always talking to our patients about the dangers of buying products on Amazon. And again, I'm not going to go into all of the details, but at the end of the day, you need to make sure that you are consuming high quality tested supplements that have been credentialed. I mean, you can't continue to put things in your body from like Walmart and Walgreens and things like that because they're full of stuff. And then the other piece is if you are on medications, know what nutrients are going to become depleted because there are medications that cause nutrient depletions. And so we're always looking at people's medications and then making sure that we're supplementing with certain ones that are just known to cause a deficiency. Essential supplementation, in our opinion, what we're constantly talking to our patients about is magnesium, no brainer. Vitamin D, absolutely. Vitamin B12 or just a B complex. Some type of anti-inflammatory type of products. So fish oil, curcumin, resveratrol, definitely a probiotic and a prebiotic. Definitely ensuring that you're getting enough fiber. A multivitamin or a multimineral is really helpful. And then also not only, again, just looking at the supplement, but if there are gut issues, we have to consider different forms of supplementation because most of supplements in like capsule and things like that won't even really be absorbed or utilized when there's significant gut issues. Other supportive supplements that can be really helpful during weight loss, liver support, blood sugar balance products such as like alpha lipoic acid, chromium, berberine is amazing. And mitochondria support is also very, very important. We're talking about this with our patients often, but these are just some examples. L-carnitine, CoQ10, if you're taking a statin, absolutely have to take CoQ10. And then there's a product called mitochondria ATP, which can be really, really helpful. And that you need healthy mitochondria because that is going to help you burn fat, and that's going to help transport certain fats into the mitochondria so it can be used for energy. And again, it's just something that, if you're working with someone, you can ask about certain products that will kind of accelerate the process. Gut health supplements, pre and probiotics. These are, again, just some examples that you might want to look into. Stress and sleep support, extremely important. We have a lot of success with these particular products that are outlined. And the diet. So the diet is driven by your metabolic health. If you are metabolically healthy, you can incorporate some healthy carbohydrates. If you are metabolically unhealthy, you need to limit your carbs because most conditions that people are experiencing right now is metabolic dysfunction. And the root of metabolic dysfunction is a dysregulation of your sugar in your body. So whether that be, you're pre-diabetic, you have PCOS, you have inflammation, you've been diagnosed with autoimmunity, oftentimes the root is blood sugar dysregulation. That's what causes the inflammatory response. So since the majority of conditions stem there, you have to fix the blood sugar dysregulation. So it means that if you're not doing that well, you can't continue to eat a high carbohydrate diet and sugar and junk because you are just kind of keeping yourself in that sick state. So you have to clean up the diet, consider intermittent fasting. That can be really powerful. We are constantly talking about getting, extending time between meals, stop snacking. That's just feeding the beast. You will never use your fat cells if you're just snacking all day long. And another thing to keep in mind, since a lot of people are using trackers and devices to see how many calories they burned and how many calories they consumed, which I definitely love. I think they can be very helpful. But when we're assessing calories and things like that, it's just nowadays it's just not accurate because of all of the metabolic dysfunction. So just be mindful of that when you're really trying to dig deeper into what an adequate calorie amount is for you. So we have many different resources for your use that we will be providing And you can see we have like a booklet that has many different tips as you transition off of a GLP. And it's really important for you to start to think about how will you stay accountable, remain connected to whether you remain connected with us or you remain connected with the practitioner that you're working with. That is going to be crucial for your success. You know, are you still going to log? You don't have to log every day, maybe even twice a week of food logging. You definitely want to monitor your body composition changes. This is, in my opinion, crucial. Maybe you want to do one of our strategic weight loss programs, maybe 2, 3 times a year to kind of keep you metabolically resilient. So there are many things that you can do. It really is about finding what's going to work for you. So in summary, you really want to assess your current state of health. Does not matter where you are in your journey, just get an idea of where you are health-wise. Clean up the medications, clean up the supplements, identify regular habits that are sabotaging your health. What are the changes that you're willing to commit to? Because you have to make changes. We all need to make changes. We can't do something for a period of time and then go back to what we were doing. I mean, it just doesn't work like that. I think everyone knows it, but people still seem to think like, oh, if I could just lose this 30 pounds, then I'm gonna be good. But that obviously doesn't happen. Reinforce the foundations of health. Eat healthy, get movement, get good sleep. I mean, sometimes it can be as simple as that, but obviously we live in a different world. And have a maintenance plan ready to go, diet, exercise, and whatever is going to work for you. So, because this is recorded, I'm going to end now, but we are also, we are accepting questions if people have any questions as they go through the program. So thank you very much.